welcome to my channel. My name is Sarah and I'm currently pursuing my master's in public health with a concentration in health promotion and disease prevention. I also earned my Bachelor of Science in public health with a minor in human nutrition, which has given me a unique perspective on how food and public health intersect. Today, I want to talk about what I wish I knew about nutrition before studying public health, the myths, the science, and what actually matters when it comes to food and health. If you're interested in plant-based eating, public health methods, or just want to learn a little bit more about how food impacts our health, you are in the right place. Let's get started. Before we dive in, I want to be clear that I am not a nutritionist or registered dietitian. I'm sharing this information based on my education in public health and human nutrition, my experience, as well as research from different credible sources. My goal is to make public health and nutrition information more accessible, but if you have specific health concerns, always consult a registered dietitian or your healthcare professional. Now let's get into the video. Number 1. Before studying public health, I thought nutrition was just about eating healthy, so fruits, vegetables, and avoiding junk foods. But in reality, nutrition is a lot more complex. Public health takes a broader approach, looking at how food access, policy, and social determinants affect what people eat. For example, food deserts. Areas where people have limited access to affordable, nutritious foods are a huge issue in public health. It's not just about personal choice. Your environment affects your diet just as much as your willpower. Before learning this, I didn't fully understand how systemic issues like income inequality, marketing, and food policy shape what people eat. Number 2. Another thing I wish I knew earlier, calories are not everything. We often hear calories in, calories out as the key to weight loss or health, but that's just an oversimplification. Macronutrients, so your carbs, fats, and proteins, matter. 2 meals with the same calories can have very different effects on your body. Then your micronutrients, like your vitamins and minerals, are just as important. You can hit your calorie target and still be nutrient deficient if you're not getting enough iron, B12, or omega-3s, or any kind of vitamin. I personally used to focus on only cutting calories, but now I focus on nutrient-dense foods that support my long-term health. So a really great example of this are 200 calories of almonds versus 200 calories of soda. You can definitely see the difference here, and one is a lot better for your health. It has a lot more nutrients, has antioxidants, while the other one is just full of pure sugar. Number 3. Another big misconception that I had was that all plant-based diets are automatically healthy. While plant-based eating has a lot of great health benefits, like lowering your risk of chronic diseases, which has been shown through a lot of different studies, it's possible to be plant-based and still eat very poorly. For example, a diet full of processed vegan foods like plant-based burgers, fries, and sugary drinks are not necessarily healthier than a balanced diet that includes some animal products. The key is to focus on whole, minimally processed foods, whether you're fully plant-based or not. Number 4, if I could go back, I would pay a lot more attention to my gut health. Your gut microbiome, basically the bacteria living in your digestive system, plays a huge role in your overall health, affecting digestion, immunity, and even your mental health. So fermented foods like sauerkraut, kimchi, and yogurt can help you maintain a diverse gut microbiome. Fiber is very essential. Most people do not eat a lot of fiber. It's actually been shown through different articles that we as Americans are not getting enough fiber in our diets, but it's extremely crucial for our gut bacteria. Whole grains, legumes, fruits, and vegetables are your best sources of fiber. Antibiotics and ultra-processed foods can also harm your gut health over time, but if your doctor prescribed your antibiotics, please finish the full cycle. I used to ignore my gut health, but now it's one of the first things I think about when choosing what not to eat. So, those are the biggest things I wish I knew about nutrition before studying public health. Nutrition isn't just about what we eat, it's about our accessibility, our food quality, gut health, and the way food interacts with our bodies. The whole reason I created this channel is to create access to information that, in my opinion, should be taught regularly in schools so people know about public health issues and nutrition, not just for their own health, but for their family's health as well. By all of us focusing on public health issues, we can improve our access to resources, education, and ultimately improve our health long term, which is super important. If you like this video, please like and subscribe. I added all the references to the information I talked about in the description in case anyone wants to read a little bit more. What's one thing you wish you knew about nutrition earlier? Let's start a conversation. Thanks for watching, and I'll see you all in the next video. Bye!